Good morning, viewers. Today I am going to introduce to you this lady who is sitting here. Her name is Sukuna, and I will let her talk. And she's undergone this treatment for her knee arthritis 2 weeks back. I will let her speak, and then you will come to know about her experience in India. Welcome, madam. How are you?
Thank you very much, Doctor, for your welcome speech. I should say it's exhilarating to be here with the doctor and to also share my experience of what I've undergone, the medical procedure that I've undergone with Dr. Venkatachalam. I had severe osteoarthritis issue, and my condition was pretty bad. I had arthroscopy on both my knees, and after that there wasn't much of any other procedures to improve the condition, so the pain has been increasing. And I should say, by God's blessing, I happened to bump into one of the Google sites where Dr. Venkatachalam had talked about stem cell therapy on the knees. And I should also say that I'm from Singapore, and in Singapore, although there is something called a stem cell therapy, it is still inconclusive. So doctors are not that very confident that one can go through that procedure to be cured. So I should say I took the risk of writing to Dr. Venkatachalam about my condition, and it was quite brief. He immediately said, "Come over." And so I came over to India from Singapore, met him, and I think within a couple of days I was in the hospital, and he did this stem cell therapy on my knees, on both my knees, and since then, what can I say?
14 days today.
It's been 14 days.
You had the procedure on 13th.
On the 13th of May.
And
today is the 27th. It's been
2 weeks exactly.
Yeah. Pain has gone.
The arthritic pain is gone.
The osteoarthritis pain is no more. Okay, I'm
very pleased.
Yes, I'm very confident to say there's no more pain of that sort which I had. But there is an impact of the knee procedure which took place, the medical procedure which took place, but doctor has given me the confidence with continuous physiotherapy, the pain will decrease, subside, and I will be able to walk very well. I'm looking forward to that.
And I have requested you to come back for a review after a year's time to, of course, document your condition.
Absolutely, yes.
The continuing pain relief. And then we will also get an MRI at that time.
Yeah.
And now you had a special MRI here, 3 Tesla MRI, and you know the findings with the cartogram and all that.
Yeah.
So 1 year later, when you come back, we will repeat the MRI and we'll see if there has been a regeneration of cartilage.
Absolutely. I think your MRI showed that my cartilage was totally eroded. And
it was grade 4.
Yes, it was great. Yes, my condition was grade 4, and I am looking forward to seeing you again by next year to find out what's the outcome, whether the condition has improved, the condition of my knee, bones, and I think you said that I have an edema. Is that right?
In the bone edema.
Bone edema.
Yeah.
Yes.
That is, the cartilage is like a shock absorber.
Yeah.
So when you wear a helmet, that acts as a shock absorber.
Yeah.
So if the helmet becomes weak, then the force is transmitted to your head, bone.
Exactly.
And similarly, in the knee also, when the cartilage, which is a shock absorber, wears out, as in your case, that is 100% in places, 75 to 100%.
Yeah.
Then the bone is subjected to the pressures and rigors of everyday life.
Correct.
It breaks up, and moreover, we did your vitamin D level. Living in Singapore, so the bones were weak.
Yep.
So that is where I've injected the growth stimulating substance called PRP, which will help to regenerate bone. And on top of that, you might not know, but the physiotherapy which I sent you for, that is a very advanced form of physiotherapy. You might have had it for 2 days.
Yeah.
That is called extracorporeal shock wave therapy.
Correct.
So that, when applied to the bone, will actually send shock waves into the bone just beneath the cartilage,
Yeah.
and blood flow is stimulated over there. Bone growth is stimulated. There is a paper from China which says that that bone will regrow. So once that bone regrows, and also with the continuing with the, if you start taking the medication which I prescribed for you,
Yeah.
vitamin D,
Vitamin K2.
calcium, and vitamin K and magnesium and all that. Oh, and of course your diabetic status.
Okay.
One more important thing, it turned out that you are not a known diabetic, but it turned out that you were diabetic and you required help. So that also contributes to
the knee
arthritis.
Okay.
It's just knee arthritis is not a thing in isolation.
It's a combined.
It's the result
mobility,
of
combined mobility.
the body's metabolism going down. So when the body is not generating sufficient food and sending it to the required areas, like from the liver, it has to go to the cartilage cells also.
Okay.
If the liver is not doing its job well, food and oxygen will not go to the cartilage cell. So that is why we have to take care of the diabetes, and I'm sure you will take care of that.
Sure.
So the overall regenerative treatment has been applied to your knee, to either the bone and to your body as well, by the diabetic diet and vitamin D3 and all that. And as a combination, you should not be 1 year older, but 1 year or maybe a couple of years younger next time.
I'm very glad to hear that, Doctor. Yes, certainly. I feel much younger now, and I feel very energetic. So I am really very, very pleased with Doctor's treatment. And I would say, in a heartbeat, whoever has an issue, someone like me, don't have a second thought. Come and see Doctor, and I'm sure he will find a way. He has got magical touch, I should say. So do come and see the doctor, and I'm sure there will be some relief from your pain as well. This is my experience, and I'm sharing my experience with you.
Okay.